Miss Martin.
Hi.
Hey, my name's Eric. I'm your nurse.
Good to meet you.
How are you?
Good, how are you?
Great. Nice to meet you.
Yeah.
So, I'm going to have a seat. Thanks for inviting me into your home today to do a health assessment.
Oh, yeah, my pleasure.
Okay, great. So typically I start health assessments off with questions. I'll ask you some questions to get to know you about your health care, and then we'll get into like a head-to-toe assessment, which is a physical examination.
Okay.
So, tell me your full name.
Jennifer Lynn Martin.
Tell me your address.
It's 214 Old Hickory Boulevard, 176, Nashville, Tennessee, 37221.
Okay. What's your phone number?
615-448-8530.
Your age.
31.
Your birth date.
12/16/83.
Your birthplace.
Charleston, South Carolina.
Alright. Your gender.
Female.
Marital status.
Divorced.
Okay. Have you had? Have you been divorced once or how many marriages have you had?
One.
One marriage. Been divorced once.
Mm-hmm.
What's your race?
Caucasian.
Caucasian. Tell me your ethnic origin.
French, Native American, Scottish, German, but I'd consider myself American, so.
Do you do you tend to do any of these ethnic origins? Do you tend to relate to the most or favor?
Favor French.
Does that play any kind of part into like your health care concerns or spiritual or cultural concerns when receiving health care?
No.
Okay. What's your occupation?
Student and daycare worker.
Okay. Tell me your reason for seeking health care today.
Just preventative, kind of get an idea of where I'm at health-wise, that sort of thing.
Do you have any health issues going on currently? Anything that's on your mind?
Just some pain in my knee, my left knee, and my left shoulder.
Okay. What causes these kinds of pain?
It's usually during weightlifting.
During weightlifting? What makes this better?
With my knee, just not weightlifting. And then with my shoulder, kind of have to position myself on my back or my stomach when I sleep.
What does it feel like?
It's a sharp pain in my shoulder, sort of a crackle, sharp pain, like a pulling sensation in my left knee.
How severe is it?
On a scale of 1 to 10, the knee, maybe a 3. My shoulder, when it hurts, maybe a 7.
Does it radiate to any places?
No.
So it stays localized in your knee and your shoulder?
Mm-hmm.
Okay. When did this first occur?
About 3 years ago in my shoulder, and I just started noticing my knee about a month ago.
How long does it last?
It depends on how long pressure's being put on it. There's no pressure, I don't feel anything.
And how often does it occur? Strictly when weightlifting?
My knee strictly when weightlifting, my shoulder at least once a day.
What kind of things are you doing that aggravate your shoulder? Once a day?
Position when I sleep.
Okay, stays true to what you said earlier. What do you think it means?
I don't know. I did dislocate that shoulder 4 years ago. So there could be scar tissue, that's my guess.
Okay. Sounds like to me you have a good grasp on what causes it, and that's definitely an important part of when it comes to getting you adequate health care, to know the things that it causes. So that, for me, it's if I know what's causing your pain, I can help you to cease your pain. Okay. Tell me a little bit about your family history of health. What kind of health issues have you had in your family?
My dad's side, not too many. My dad has an arrhythmia, and his dad had hypertension and died of a heart attack. His mother, no real issues on that side. And then my mother has multiple myeloma, which was decided it was not genetically related. And then her family has a history of alcoholism. And her dad, I'm not sure. But I know he did have triple bypass surgery from smoking for he had COPD and a number of other issues.
So what I'm hearing mostly is that we got some heart issues in your family, a situation of myeloma that's not genetically related, and a heart issue that's related due to smoking.
Right.
Okay. Now, I asked you earlier about your culture. What kind of cultural considerations are important to you when it comes to health care?
When it comes to healthcare, all that comes to mind is that I'm Southern and manners would matter, but common courtesy, that sort of thing. Nothing else.
Do you have any spiritual considerations when it comes to receiving health care?
No.
Okay. Can you perform activities of daily living, such as bathing, toileting, or dressing independently?
Yes.
Okay. So the shoulder knee doesn't influence the way that you can do your... Okay. What's your education level?
Some college right now. I have an associate degree in science and in nursing school right now.
What's your financial status?
I would say poverty level.
Poverty level.
Call it student status.
Okay. And what are your personal strengths?
Optimism and determination and friendliness, I would say.
Now, do these things influence the way that you have a concept of yourself?
I would say.
Just being at the poverty level, or does that influence the way you perceive yourself and your education level, and do your personal strengths, do you think help you with the self-concept?
My personal strengths help me deal with the poverty level status and the student status because I realize it's a short-term, temporary situation. And the reason that I'm in that situation is because I have the determination to become better than what I was. So, yeah, I would say it all kind of goes together.
So, Ms. Martin, do you exercise?
Yes.
Okay. What kind of exercise do you engage in?
Weightlifting and cardio.
Cardio. What kinds of cardio?
Biking and walking.
Mm-hmm. And what hobbies do you enjoy?
I enjoy cooking. Enjoy painting, gardening, making crafts, music.
Do these hobbies, do they like influence your health in any specific way?
Yes, when I've been very stressed out, gardening was definitely therapeutic. And so was painting. Painting I did more just for enjoyment, but gardening was very therapeutic.
So it sounds like you engage in a lot of your hobbies to relieve stress and...
Yes.
Okay. What foods do you typically eat?
A lot of tuna, salmon, eggs, a lot of high protein foods and yogurt, and green veggies.
Do you ever consider that your diet's limited by finances?
Sometimes, but I usually find a way to make that a priority over other things. So.
I may ask you to write me a diet log of what you've had. If you can recall what you had yesterday, I would like to just analyze your diet log so I can kind of see a little more.
Okay.
Do you drink caffeine?
Yes.
Okay. What kind of caffeine drinks do you like, and how many drinks do you have a day?
1 to 2 cups of coffee. Well, very large cups. And then 1 energy drink a day.
Are you familiar with caffeine consumption and its effects on the body?
Some.
I would like to discuss some of that with you later on. Okay. What is your usual pattern of bowel and urinary elimination?
Bowel 1 to 2 times a day, urinary maybe every 2 hours.
Has this been consistent lately?
Mm-hmm.
Okay. How would you describe your current family role?
Currently I'm not as involved as I used to be, but I probably consider myself the neutral party in the family, the one that talks to everybody, and sometimes I take care of my mother when I can. I'm the closest to her and my dad.
Okay. You mentioned that you're married earlier
Mm-hmm.
and divorced now. Did you have any kids from that relationship?
I did. I have 2.
Okay. Tell me your role now in that relationship.
That's changed quite a bit. Up until a month ago, I was a single mother for about 4 years. And so I'd say I fill just about every role as a parent. And now they're in Germany, so my role I'm really not certain of right now.
And do you have difficulties dealing with that role change, or how do you perceive yourself now that your role as a mother is different?
I am having difficulty with it. Trying to stay optimistic and realize that it's not forever, but it's still something I'm trying to process.
Alright. I'm making a few notes here. Okay. Now, who can you go to for support when you need support with your daily life? Who are the people that you count on to help lift you up?
Primarily my boyfriend right now. Sometimes my mother. Sometimes my dad. And those are my go-tos. But my boyfriend's been really great. Really great support, listener, helping me sort things out.
Do you feel like your support system is sufficient?
Yeah, I do.
Okay. How do you describe your time spent alone? Do you say it's enjoyable? Do you find yourself to be relaxing? Do you find it difficult to be alone? Combination of these?
Combination. I'd say most of the time I do really well alone as far as getting tasks done, and I do like to stay busy. I'd say I'd have a harder time sitting still alone but I use that time to get a lot of things done. Exercise if I can. I prefer to be with someone versus being alone, but I enjoy both.
Because only in your alone time, typically it's spent maybe doing your hobbies or doing other things of that nature. Does your religious faith play an important part in your life?
I guess I'd call it something else, but yes.
Okay, or spirituality.
Yes, very.
Okay. How does it play an important part in your life?
I feel the need to get in touch with it when making a decision about where to go, and whenever I feel thankful about something, or whenever I'm struggling with a thought or an emotion, I try to sort of meditate on it to get a clearer idea of what I should do.
So it sounds like meditation is kind of your go-to thing when you're having troubles in your life.
Mm-hmm.
Do you have any other kind of spiritual, religious things that play an important part in your life, other than meditation?
Prayer. Not as much, but I do.
Okay. How does religion or spirituality influence your health?
Maybe it reduces stress. I don't know. It makes me feel more peace about things, so I guess that would sort of help me maintain a happy, less stressful disposition. I don't know.
So it sounds like that religion and spirituality, they decrease your stress, which helps to provide you with better health.
Mm-hmm.
Okay. And you mentioned your hobbies as well that help to lower your stress level. Are you part of any religious or spiritual community or organization?
No.
Okay. Would you like me to address religion or spirituality concerns with you?
No.
Okay. And what stresses have you had recently, or do you have currently?
My two sons going to Germany. I guess a lot of big changes I don't feel stressed over now, but recently moving and financial stress, and maybe some stress over finishing school, anticipation of a new semester. That's about it right now.
And we mentioned earlier that you cope with stress typically by engaging in your hobbies and meditation and sometimes prayer. How else do you cope with stress?
Talking about it, if I can. Sometimes, if things are too stressful, I tend not to, but usually if I feel like it's something I can deal with, I'm more apt to talk about it, and that helps.
And you can talk about this with your support system.
Mm-hmm.
And then when you're too stressed out and don't talk about it, what do you typically do?
If I can, I try to make a list of things that I can do at that moment to make it better, to kind of relieve my stress. Try to get sleep to see if I feel different about it the next day. But I won't say I've always dealt with it in a healthy way, just sort of hold it in.
Do you smoke, drink, or do drugs?
Drink.
You do drink. Have you ever smoked or done drugs?
Yes.
Okay. So, in regards to smoking, have you been able to successfully quit?
Yes, I'm happy to say that I have.
Okay. And as far as the drugs go, that's
High school days,
High school days.
marijuana.
And you mentioned that you do drink. Have you ever thought about cutting down on your drinking?
Yes.
Are you ever annoyed by criticism of your drinking?
No.
Have you ever felt guilty about your drinking?
No.
Do you drink in the morning?
No.
Okay. Are there any health hazards, whether it be chemicals or environment, where you live or work?
Not that I'm aware of.
Okay. How are things at home?
Great.
Great. Do you feel safe at home?
Very.
Okay. You ever been physically, emotionally abused by your partner or someone close to you?
Current or past?
Basically, past and current.
Past.
How about currently?
No.
You mentioned that in the past you had. Were you ever forced to have sex?
Yes.
Were you ever physically abused by your partner?
No.
Okay. When you were forced to have sex, tell me about that.
I would say I was guilted into it. My ex-husband was back on R&R from deployment, or on a deployment to Iraq, and I had just given birth to Tanner, so 6 days postpartum, and he made it seem like he could die at some point in the deployment, and that I needed to do that. It was like as a dying wish kind of thing. It was pretty awful.
Tell me a little bit about your current job.
It's great. Work at a daycare at a gym, and slow stress, lots of kids, helps me get my mommy fix, taking care of kids and fulfilling that role since I can't with my boys right now.
Okay. At your job, are you exposed to chemicals, environmental hazards, or any repetitive motions?
Repetitive is just bending over, whether it's picking up toys or picking up kids.
Okay. One thing I can address with you later is proper body mechanics when bending over.
Okay.
Typically when you bend over, you want to bend with your legs, not your lower back.
Okay.
So try to think about, instead of bending over, think about squatting down to pick things up. It'll also make you stronger too. Have you had any health problems related to work exposure?
No.
Okay. How do you define your health? Or in general, how do you define health?
Mainly feeling good. Not having any issue, like not having to be on any medications to make myself better, feeling good throughout the day.
How do you view your health now?
I'd say pretty healthy.
So you're feeling good and you're not taking any medications currently? What are your health goals?
Not having joint issues, being able to lift more weight, losing a little bit more body fat, and preventing any issues.
What do you expect from your nurses, physicians, or other healthcare providers?
Things like the knee and the shoulder, just ways to prevent or aid that, whether it's taking a supplement or whatever. If there's an easy fix for that I can do at home, I'd like to know that. And also to know where I stand as far as my health currently, and whether I'm on the right track to stay that way, or if there's things I need to change.
All right. Is there anything else that you feel like you need to tell me?
No.
Okay. So this concludes the verbal assessment.
Okay.
Now we can start the physical assessment. I'll need you to change into something comfortable,
Okay.
that you feel comfortable for me to assess you in. Also, I left a urine cup in the hallway, so on your way to change, I just ask if you can urinate in that now or some point later, so that I can collect a urine sample from you.
Okay.
All right. Well, I'm gonna exit and let you get dressed or do what you need to do to get ready for the physical part. Okay.
Okay.
All right. Ms. Martin, it's been nice meeting you this far.
You too.
I'll see you in just a little bit.
Okay.
Okay. Thank you. Okay, Miss Martin. It looks like you dressed and you're comfortable. All right. The urine specimen that I left for you in the bathroom. Did you have time to urinate in that cup?
I did. I left it in the bathroom.
Excellent. Okay, I'm going to start the examination by getting measurements of your weight and height. I'm going to take your vital signs.
Okay.
Go ahead and stand on this scale for me. Okay. 124 pounds. Miss Martin, how tall are you?
5'2".
5'2". Okay. Okay. Go ahead and have a seat. I'm gonna look at your vital signs. Thank you. Okay. Okay. Looks like your respirations are at 18 and your pulse is about 72. Alright. Now, Miss Martin, typically now I would use a Snellen and eye chart, but but you report that you've been going to your optometrist regularly because you do wear contact lenses.
I do.
Do you have any appointments scheduled?
Actually, yeah, in about 3 weeks I'm going to go see my eye doctor.
Okay, it's good that you're maintaining that so we can see where you are. Okay, Miss Martin, I'm going to take your temperature.
Okay.
Alright. 97.8. Okay. Miss Martin, are you having any pain right now?
No.
No pain. Okay. Alright, Miss Martin. Now I'm going to take your blood pressure. Go ahead and extend your left arm somewhat for me. Thank you. Okay. Go ahead and relax your arm for me. 118/76. Okay, Miss Martin, I need to inspect your hands. Okay? Right now I'm looking at the temperature of your hands, feeling that, the moisture, the texture of your hands, the turgor of your skin. I'm looking at your nail beds, maybe for clubbing or for any different things. Alright. Okay, Miss Martin, I'm going to inspect your scalp, your hair, and your face. Okay. I'm looking at your face for symmetry. Miss Martin, can you raise your eyebrows for me? Can you puff out your cheeks? And smile big for me. Excellent. Okay, I'm going to press on your temporal arteries. Okay. Now, go ahead and open your mouth for me. Okay. Alright. I'm going to palpate your maxillary and frontal sinuses. Do you have any pain or tenderness when I press?
No. Nope.
Okay. Miss Martin, I'm going to assess your eyes now.
Okay.
Okay. So take this piece of paper and I want you to cover your left eye. Excellent. Let me know when you can see my hand.
No. No. No.
Okay. Cover your other eye.
No. No. No.
Excellent. Alright. Thank you, Miss Martin. Okay. Now, Miss Martin, I'm going to take a look at your corneal light reflex.
Okay.
Look at me. Walk around. Excellent. Okay. Miss Martin, I want you to follow the lens of my phone, okay?
Okay.
Excellent. Okay. Go ahead and inspect your external structures now.
Okay.
Your eyeball. Look up for me. Look to the right and to the left. Okay. Look down for me. Look to the right. Look down to the left. Okay. And look all the way down. Excellent. Okay, I'm going to darken the room now, and I'm going to look at your pupillary light reflex.
Okay.
Okay. Excellent. Excellent. I'll brighten the room now. I want you to look at my top of my phone. Now look at the wall behind me. Alright, look at my phone. Look at the wall behind me. Excellent. Okay, Miss Martin, now I'm going to assess your ears.
Okay.
Okay? Now I want you to tell me if you have any pain or tenderness when I press.
No.
Okay.
No.
Okay. Miss Martin, I'm going to perform the whispered voice test.
Okay.
I need you to cover your right ear, the tragus of your right ear, which is right here.
Okay.
Okay? And I will whisper something into your left ear and tell me what you say.
Okay. March. July. June. December.
Okay. Alright. Now let's do the same for the other ear.
Okay. August. September. April. October.
Excellent. Now you told me that your primary care provider, he checks your hearing with an otoscope.
Mm-hmm.
Okay. Do you have an appointment set up with your primary care provider?
I do.
Excellent.
In February.
In February. Okay, excellent. Miss Martin, I'm going to inspect your nose now.
Okay.
Okay. Looking at the external structure there. Okay. I'm going to test the patency at each nostril.
Okay.
All right. Sniff. Okay. And sniff. All right. See some little bit of difficulty there. Do you have sinus issues?
A little bit today.
A little bit today. I'm going to look inside your nares. All right. Miss Martin, now I'm going to look at your lips and inside your mouth, okay?
Okay.
Alright. Touching your lips. Alright. I'm going to glove up and get my materials ready to inspect inside your mouth.
Okay.
So are you feeling comfortable?
I'm pretty comfortable.
Excellent. Okay. I've got a sterile cotton swab now. All right. Go ahead and open it up for me. I'm going to inspect the top of your tongue. Raise your tongue for me. Excellent. Buccal mucosa there. Your teeth. Which is for me. Alright. Go ahead and lower your tongue flat. Okay. Now say ah.
Ah.
Miss Martin, relax, please. Keep your tongue down. I need to see your U-bone there. Ah. Excellent. And I see presence of some tonsils there too.
Mm-hmm.
Okay. Now, I'm going to test your gag reflex, okay?
Okay.
Excellent. Miss Martin, stick your tongue out for me. Excellent. Okay, Miss Martin, now I'm going to inspect your neck.
Okay.
Look for symmetry, lumps, or pulsations. Alright. I'm going to palpate your lymph nodes.
Okay.
I'm going to feel for your carotid pulse here. Okay. Excellent. Now I'm going to listen to it for bruise with the bell on my stethoscope. Okay. Excellent. Palpate your trachea. Alright. Miss Martin, I want you to look down at the ground for me. Look up at the ceiling. Look to your left. And look to your right. And shrug your shoulders. Okay. Now I'm going to do the same thing again, but I want you to go against my resistance.
Okay.
Push into my hands. Okay. Push back into my hand. Right. Look to your left. Look to the right. Shrug your shoulders. Excellent. Now I'm going to palpate your thyroid gland.
Okay.
Okay. What I need you to do is take some sips from your water jug.
Okay.
Upon my instruction. Okay. I'm going to come behind you because this is the optimal position for me to feel it.
Okay.
Okay. Go ahead and turn a little bit this way. Okay. We can do that. Okay. Go ahead and take some sips of water. One more time. Excellent. All right. Miss Martin, I'm going to ask that you take your shirt off so I can assess the posterior portion of your back. Okay. Right now I'm looking for symmetry in your back and trying to see maybe skin characteristics as well. Look at your thoracic cage. Excellent, excellent. Go ahead and take a breath for me. Excellent. Now I'm searching for tactile fremitus. Say 99.
99.
Blue moon.
Blue moon.
99.
99.
Blue moon.
Blue moon.
99.
99.
99.
99.
Blue moon.
Blue moon.
99.
99.
Blue moon.
Blue moon.
And blue moon.
Blue moon.
Excellent. Now, Miss Martin, do you have any lump, like tenderness when I touch here?
No.
Okay. I'm assessing for lumps as well. Any tenderness at all?
No.
Okay. I'm going to palpate your spinous processes. Okay. I'm going to percuss your lung fills now. Okay. Now look at your diaphragm here.
Okay.
Take it. Exhale for me. Okay. Exhale again. Take a deeper breath. Okay. Now inhale for me. Excellent. So, what I felt was here. And it's about 1.5 inches apart there. Okay. Now I'm going to listen to your breath sounds. Take a deep breath for me. Deep breath. 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 One more deep breath. Excellent. Ms. Martin, I'm going to inspect your interior chest now. I'm looking at skin characteristics. I'm looking at your respirations. Say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. I did that to check for tactile firmness.
Okay.
Take a deep breath for me. Right here I'm noting symmetric lung expansion.
Okay.
Let me know if you feel any tenderness when I palpate.
Okay.
Tenderness?
Mhm.
Okay. We're gonna percuss now.
Okay.
Listen for any kind of certain quality sounds can indicate certain health conditions, but sounds normal to me.
Okay.
Now I'm going to listen to your lung sounds. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Miss Martin, bend forward for me. That's good. Okay. Excellent. Ms. Martin, I'm going to assess your upper extremities now, your arms. Put your arms like this.
Okay.
Raise your wrists. Lower your wrists. Okay. Extend your arms. Bring them up and bring them down. Take your shoulders and raise them up like this. Okay. Now we're going to repeat the same exercises, but I want you to try and resist my force, okay?
Okay.
Extend your wrists. Push up. Nice. Push down. Excellent. Now extend your arms.
Oh.
Okay. There you go. I'm gonna go underneath you. Push down. Nice. Now, Now raise your arms against my resistance. Nice. And we'll go. Excellent. Alright, you got good range of motion and good muscle strength. Ms. Martin,
Yes.
I'm going to check the your upper thoracic cage, your axilla.
Okay.
Now, you mentioned to me that you see a gynecologist regularly. I need you to demonstrate for me how you would check your breast for lumps or tenderness.
Okay. I check about once a month in the shower. Start my armpit, work my way down, and then from the nipple I'll push outward, feeling for any lumps or tender spots, and then I inspect it for any dimpling.
Alright. Okay. I'm going to assess your axial lymph nodes.
Okay.
Go ahead and raise your left arm for me. Excellent. Okay. Okay. Ms. Martin, I'm going to inspect your neck vessels and also your heart.
Okay.
Okay? Turn your head to the left for me. Excellent. Okay, turn your head to the right. Excellent. Okay, I'm going to inspect your heart now. I'm going to lift your sports bra up lightly just to
Okay.
see what I can see as far as the heart.
Okay.
Any vibrations I see. Okay. Okay, I'll lift your now.
Okay.
Okay. I'm going to palpate your heart now.
Okay.
This is the apex of your heart here. Okay. I'll palpate the precordium. Okay. I'm going to listen now. And we'll do that again, the bell of my stethoscope.
Okay.
Goodness, Martin, lay on your left side for me.
Okay.
I'm going to also take the left side of your heart here.
Okay.
Okay. Excellent. Okay, Miss Martin, I'm going to inspect your abdomen. I'm looking at the skin characteristics, looking at the contour of your abdomen. I can see respirations, I can see pulsations. Listen to your abdomen symmetrical. I'm going to listen to your bowel sounds. Listen to your arteries. Okay, I'm going to percuss your abdomen. Okay, percuss your liver. Mark it. Okay. I'm going to percuss your spleen. I'm going to lightly palpate your stomach. I'm going to deeply palpate your stomach now. Let me know if you have any tenderness. Okay. I'm going to palpate your liver. Your spleen. And your kidneys. And your artery. Okay. Miss Martin, I'm going to inspect your inguinal area.
Okay.
I'm going to be looking at like lumps, swollen tenderness in your lymph nodes, as well as be palpating your femoral pulses.
Okay.
All right. Okay. I'm going to palpate your femoral pulses. Okay. Miss Martin, I'm going to inspect your legs. You can zip up your hoodie now. looking at skin characteristics, leg symmetry, hair distribution, potential edema. Okay. Miss Martin, I'm going to palpate your pulse. Okay.
Okay.
It's your popliteal pulse. Okay. And your Tachycanus pulse. And your dorsalis pedis pulse. Excellent. Alright. Do the same thing for this side here.
Okay.
Excellent. Excellent. I'll palpate the temperature of your legs. Okay. And I'm going to also palpate for pretibial edema. Okay. I'm going to inspect your toes now.
Okay.
Okay. Now I want to test your range of motion and muscle strength. Miss Martin, can you raise your left foot towards the ceiling? Excellent. Lower it. Go against my resistance. Come down on my resistance. Excellent. Now bend your knee to your chest. And bend your knee down towards the ground. There we go. Now do it again against my resistance. Excellent. Okay. Now flex your toes towards your face. There you go. Your ankles there. And point your ankles downwards. Now against my resistance. Excellent. Now can you put your toes downwards and toes upwards? Excellent. I'm going to do the same thing on this side here.
Okay.
Raise your right foot towards the ceiling. Raise it down. Excellent. Go against my resistance. Yes. Good. Raise your right knee towards your chest. Down. Against my resistance. Okay. Point your ankles towards your face. And down. Now go against my resistance. Excellent. Now point your toes down. And point your toes up. Against my resistance. Excellent. Okay, Ms. Martin, can you put your right heel and run it along your left shin? Excellent. Now do the same for your left leg. Excellent. Now, Ms. Martin, can you sit up for me? Excellent. Ms. Martin, hey, I'm going to test your neurologic function. I need you to close your eyes for me. Okay. I'm going to test your ability to detect superficial pain. I want you to tell me if the object that you feel is dull or sharp.
Alright. Dull. Sharp.
Excellent.
Dull. Sharp.
Excellent. I'm going to detect your ability to detect light touch. Okay? Tell me when you feel the object.
Feel it. Feel it.
Excellent. I'm going to detect your ability to detect vibration.
Feel it. Feel it.
Okay. Now, Ms. Martin, I'm going to hand you a familiar object. I want you to tell me what the object is.
Okay. A pen.
Excellent. I'm going to take a hold of your hand, and I want you to tell me when I move your finger up or down, if you feel it up or down.
Okay. Down. Up.
Excellent. Miss Martin, can you touch your finger to your nose? Excellent. Now, Miss Martin, open your eyes, and I want you to do this with me. Excellent. Keep going. Go faster. 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 Slower. Slower. Stop. Excellent. All right, Miss Martin, I'm going to test your reflexes now. Okay. I'm going to turn your chair this way. Okay. And I'm going to take a hold of your arm. Thank you. Excellent. 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 I'm going to come around and do the same thing on this side.
Okay.
Hold your chair a little bit that way. Thank you. Excellent. Great. Okay. And then your brachioradialis here. Great. Okay. Now move down to your lower extremities. Test your quadriceps reflex. Great. Great. Like the plantar reflex. Excuse me, your Achilles reflex. Great. And this is your plantar reflex. Great. Same thing on this leg. Excellent. Miss Martin, I need you to take your right heel and rub down your left shin. Okay, now do the same thing with the left leg. Excellent. Miss Martin?
Okay.
Okay, I'm going to inspect your legs.
Okay.
I need you to stand up out of the chair.
Okay.
Okay. Go inside that chair back. Okay, now, okay, turn on backwards for me. All right. Excellent. Miss Martin? Hey, okay. Now I need to test your musculoskeletal and neurologic function of your lower extremities. I need you to walk towards me. Now I need you to stop and turn around. Now walk back in a heel to toe fashion. Okay. Now walk to me on your toes. Alright, stop. Now walk back on your heels. Alright, now I need you to walk and meet me in the middle. Excellent. Okay. Now bring your feet together and close your eyes. Alright, Smart, you need to open your eyes. I want you to take a hold of my hand. Okay, now perform a shallow knee bend on your left leg. Alright, and now on your right leg. Excellent. Okay, Miss Martin, I need to assess your spine, so I need you to take your shirt off for me. Okay, I need you to bend down and touch your toes. Okay, I'm going to look at your upper spine. Alright, go ahead and come up for me.
Okay.
I'm going to test the range of motion of your spine. I need you to hyperextend your back. Excellent. Now rotate from side to side. Okay, now I need you to bend like this, laterally. Alright. Miss Martin, so in a typical nursing assessment, now would be the time when a vaginal examination would be performed. However, you told me that you had a gynecologist appointment on February 3rd, so I don't need to check that area.
Okay.
So at this time, the physical assessment is complete.
All right.
I'm going to let you get dressed. I'm going to exit the room, and then I'll come back and discuss my findings with you.
Sounds good.
Okay.
All right.
Excellent.
Thank you.
It's been a pleasure working with you.
Yeah.
Thanks. I've gone over your assessment findings, and I didn't note any health abnormalities. So what that means is it appears that you're in very good health.
Oh, good. Good.
Do you have any questions?
When should I do this again or follow up?
Typically, nursing assessments are done once a year, but if you have the need or desire for another nursing assessment, you can always give me a call, and I can be available to do so.
Okay.
Do you have any other questions?
No, that sounds good.
Okay, if you have any other questions, I want you to call me later, okay?
Okay.
All right. It's been a pleasure working with you.
Yeah.
Maintain your appointments. If any of that stuff changes, let me know.
Okay.
And I can help you find another provider if anything happens, okay?
All right. Thank you so much.
Okay, excellent. Thank you for inviting me into your home.
Yeah, that was good to meet you.
It's great working with you.
Yeah.
All right.